So it's pretty easy to find some products that promise a bright white smile, but figuring out which one is the best option for you, it can be pretty tough. So this morning, we're doing the research for you. We're talking with Dr. Sean Moriarty, who, did I get that right? Moriarty.
You got it.
Yes, I've been trying like 3-4 times. You're a dentist in Lidditz, opening another office in downtown Lancaster, right?
Yes, true.
All right, so we were talking, it's New Year's, everybody's talking about new resolutions, getting that bright smile. People have so many options out there. And so let's first talk with maybe the less expensive ones and the ones you can do at home. Toothpaste, we were just saying Colgate actually just released a new toothpaste called like Optic White or something.
Yes.
How does that stuff really work?
It does. There's a bunch of different options that you have. There's basically toothpaste and there's mouth rinses that you can use. Toothpaste, they have some abrasive material, some light abrasive. They're special where they just kind of take off a little bit of the extrinsic stains of the teeth.
Meaning the top layer, right?
Yeah, exactly. They don't actually remove the tooth, but they're going to get some of those superficial stains that are on the teeth. So they're good. Shouldn't really use those for long, extended periods of time, but they are effective in the short term. But again, it's going to take usually 2 to 4 weeks to see anything. They do have a new product, an ingredient which is in certain toothpaste called blue coverine, which actually will make them white right away, but it's actually like an optical illusion. It doesn't make them white, it makes them appear white. So it makes them appear a little bit less yellow.
Is that dangerous for your teeth, or is that something you want to look for in the products?
You can look for it in the products. It's not dangerous at all.
Okay, and then if you kind of go one step above that, we're talking Crest white strips, which are really easy. They're just like very thin film that you put on your teeth.
Yes, white strips are the next step up. They'll usually do about 2 to 4 shades lighter. They're great for most people because they are a certain width and they spread a certain distance. They're for basically your front 6 teeth. So if you have a very wide smile, sometimes they may not be indicated for someone like that. You may want to go to more like a custom product, like a bleaching tray or like a Zoom whitening product.
And speaking of the bleaching trays, that's the next step up in terms of cost. So you go to the dentist, you get your a mold made out of your mouth,
you get a custom mold, and then basically what they'll do is they'll take upper and lower impressions of your teeth, and then they make a custom mold that fits just you, and you can basically look in the mirror, see how your smile appears, and then you can put the whitening gel in there. And what that does is it's a little bit better than the Crest white strips, because the white strips, what they'll do is they're just going to whiten the surface of the teeth, but your teeth are not flat. Your teeth have grooves in them and spaces, so basically the custom trays will get in and it'll whiten the whole surface of the tooth.
So it's a big price difference, but if you have the money to spend it, then it's definitely worth it.
Yeah, and then also the white strips are usually 5 or 6% hydrogen peroxide, which is an active ingredient, whereas if you go up to the bleaching, it's a prescription, so you have to get it from your dentist, but it's a lot stronger, so 10, 15, 20% hydrogen peroxide.
And then that goes over a few days while you have to do that, and so the latest technology is this thing called Zoom, right?
The Zoom whitening, yeah.
So tell me about that.
So Zoom whitening is going to be your most effective. It'll do anywhere from 7 to 9 shades lighter. Bleaching tray is usually 6 or 7 shades, so on average you're going to get about 8 shades whiter with the Zoom whitening. Process takes about 45 minutes, and basically you go to your dentist's office, they'll isolate all your soft tissue, your tongue and your gums, and then they'll put the gel on it, and it uses a combination of the hydrogen peroxide gel with a higher percentage, something around 25%, and a combination of light. So what they do is they kind of work in combination, the light and the gel. They work together, and they actually break down the stains inside your tooth, okay?
Now, that kind of makes me cringe just for a second. Should you be worried about the sensitivity of your teeth or anything like that, or how do you protect that?
A little bit. There's different things you can do to kind of protect the teeth for sensitivity. You can use like a fluoride gel. They have either high fluoride toothpaste, which can be prescribed by your dentist, which you would use for about 2 weeks beforehand, and what that's going to do is that's going to allow the teeth not to become so sensitive, and then after you are done getting the bleaching done, the Zoom bleaching done, then you can apply a product which is basically going to be like a relief product, which is fluoride based as well.
All right, and we're running out of time, but I do want to quickly ask you, especially because on the morning show we live off of coffee and caffeine, Coke, Pepsi, all that kind of stuff. Do you have to be careful about what you drink and what you do kind of eat to prevent those stains from staying?
Absolutely, yeah. The best thing to do is to get a Zoom bleaching, and then maintain it with some sort of whitening toothpaste or the gel, the take-home trays, coffee, tea, red wine, colas. Those are the things that can kind of...
All of my favorite things.
Those are the things that can kind of do you in, so...
All right. Well, thank you, Sean, so much for joining us this morning. We're going to have all these links on our website, fox43.com. All you have to do is click on the As Seen On tab.